What skin conditions look like psoriasis? Imagine seeing a patch of skin that looks red, scaly, and inflamed, and wondering if it's psoriasis or something else. Several skin conditions can resemble psoriasis because they share features like redness, scaling, and irritation. But understanding how they differ in cause, appearance, and where they show up helps doctors make the right diagnosis. Eczema, also called atopic dermatitis, often causes red, dry, itchy patches similar to psoriasis. But eczema usually lacks the thick, silvery scales that are typical of psoriasis plaques. Eczema skin tends to be dry, leathery, and may crack or ooze, especially if it gets worse. It commonly appears inside the elbows and behind the knees, while psoriasis more often affects the outer elbows and knees. Eczema usually begins in childhood, whereas psoriasis tends to start in adulthood. The itching in eczema is often more intense and persistent than in psoriasis. Pityriasis rosea is another condition that can look like psoriasis because it causes scaly rashes. However, Pityriasis rosea usually follows a distinctive pattern called a Christmas tree shape on the trunk, hips, and upper arms. It often resolves on its own within a few weeks to months, unlike psoriasis, which is a long-lasting condition. Pityriasis rosea is thought to be caused by a viral infection, whereas psoriasis is an autoimmune disease where the immune system mistakenly attacks skin cells. Lichen planus causes shiny, firm, reddish-purple bumps that sometimes have fine white lines called Wickham striae. It can also affect mucous membranes like the inside of the mouth or genitals, which psoriasis rarely does. The plaques in lichen planus tend to be thinner than those in psoriasis and usually go away over months or years. Psoriasis, on the other hand, is a chronic condition that can last for many years or even a lifetime. There are also conditions called psoriasiform dermatitis that look very similar to psoriasis. These include various skin disorders with scaly, inflamed patches. Differentiating these often requires a careful clinical exam and sometimes a skin biopsy. Psoriasis itself has several types, such as plaque psoriasis with thick, silvery scales, guttate psoriasis with small red spots, inverse psoriasis in skin folds, pustular psoriasis with pus-filled blisters, and erythrodermic psoriasis that causes widespread redness and peeling. Nail psoriasis can be mistaken for fungal infections or other nail problems. It causes discoloration, crumbling, and separation of the nail from the nail bed. Proper examination and sometimes lab tests are needed to tell these apart. In summary, although psoriasis shares visual features with eczema, pityriasis rosea, lichen planus, and other skin conditions, differences in scale thickness, lesion shape, location, how long they last, and other symptoms help distinguish them. Accurate diagnosis by a healthcare professional is essential, often based on medical history, physical exam, and sometimes a skin biopsy. This careful approach ensures that you get the right treatment for your specific skin condition. If you notice any persistent or unusual skin changes, it's always best to consult a healthcare provider for personalized advice and proper care.